just speaking about alginates, for our listeners who aren't familiar with that class, because I think in training we talked about, the PPIs are really common, the H2 blockers, maybe Tums, but this class of alginates, like what's it made out of? How does it work? How is it different from the other drugs?
Yeah, and so alginates, as they may sound, actually come from algae, which a lot of people are familiar with what blue-green algae is, like the stuff that floats on ponds. But brown algae or brown kelp are like the bigger, like the seaweed type things that you see in the ocean. And so alginates, it's technically a polysaccharide, but in essence, it's such a long chain that's not broken down by the body, so it's actually a fiber. And then what happens is when you take an alginate along with a calcium source, when it hits the stomach acid, it cross-links and you get a hydrogel. So it actually forms a gel. And for the molecular gastronomy fans out there, alginates are what are used to create like boba tea and like all of the spiracles that float in like fancy foods and things. And so it's a gelling agent in essence. And so what you get is a gel, but it's not simple enough to have a gel, because if you just swallow a gel, it does nothing. So for an alginate to work, then you also have to have a carbonate source. And then when that interacts with the stomach acid, you get CO2. CO2 becomes incorporated in the gel, and the gel floats or rafts on the stomach contents and then serves as a physical barrier so that when reflux is going to occur, it's the gel that either plugs the esophagus or what goes up is this inert substance as opposed to an acid, an enzyme, or a bile salt. And so the concept of using alginates has been around since the 1970s when the original company was Gaviscon that came up with it, released the product. But for whatever reason, their product with enough alginate to actually work, they've got chewables, but the chewables don't really work. But their product that has enough alginate in it has only been released in the UK and I think maybe Canada. And so before ours and one other product, like the only thing you could do is order this stuff online, from the UK version. But so one of the questions we always get is like, oh, well, your product has carbonates in it. And we're like, well, every alginate-based product has to have a carbonate in it because it's got a raft. But the studies have shown that it's not deacidifying the entire stomach like what you're trying to do when you take a Tums. You really just get some minor deacidification in the area of the raft. And so you're not losing that I need acid in my stomach to digest food issue. And then studies have looked at it, especially in LPR symptoms, where if you're not adding an alginate to the process, you're really missing a good percentage of your patient's ability to relieve their symptoms.